Call this meeting to order for the Health and Human Services Board meeting for Tuesday, October 8th. Roll call, please.
Kay Wilson,
Here.
Tweed Schuman,
Here.
Marshall Savitsky, Chuck Van Etten, Jeff Haney, Bill Trepanier, Dawn Pettit, Carol Pearson, Sabrina Dunlap. You have a quorum.
Thank you. Let's say the Pledge of Allegiance.
Pledge allegiance to the
flag of the United States of America and
to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have a certification of open meetings law.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Our meeting agenda has been set. Okay. Public comments. Is there anyone in the public that would like to comment? All right. Approval of the minutes from our previous meeting. Motion's been made and seconded to approve the minutes from September 10th. Any discussion? All in favor?
Aye.
Aye. Opposed? So carried. Committee reports. We'll start with the LCO.
Yes, thank you, Madam Chair. I'll give LCOs tonight because Mr. Bill Trepanier is on travel and training, so. And we'll start with, I brought our new health director with us, who's been recently hired for the Lac-Courte Health Center. And as you know, we have this brand new building that's gonna reach completion here in the spring of 25. So with that, I'll have Mr. Scott Johnson come up to the mic and introduce yourself, sir. And just kind of fill us in on the new health center and what's being planned for that.
Well, good evening and thank you for inviting me.
Thanks, I wasn't sure I had it on.
We are kind of at an exciting time. Not only do we have a change of directors in the health center, but with this new facility opening, we are planning on opening in February. And that first 2 weeks of February are the times when we're trying to transition everybody in. Of course, that's contingent upon the furniture, fixtures, and equipment being installed over December and then having all of our IT work installed during the month of January. So we have been assured that our building is going to be turnkey ready come beginning of February, and we plan to move in. The facility is not quite, but close to double the square footage we're operating in now. And we are currently in 2 different buildings, and this will all be under one roof. And we will offer behavioral health, community health, dental, medical, chiropractics, physical therapy. We have
MAT?
Yeah, MAT, which is the medical assisted technician. We have imaging with our new mammography and bone scanner and all those kinds of things going in. And we have a transportation program. Pretty much everything you can think of, it's going to be there. It's going to be a very nice facility. And our staff has now grown to over 120. So it's a pretty big program, and it's been quite a learning curve for me. It's been exciting to be a part of it and working with our tribal governing board, and we have a health advisory board. Everybody's working on policies and procedures and things like that. And so, as you can imagine, there's a lot going on, and we're excited. So.
Okay, thank you, Scott. Any questions for Mr. Johnson? Okay. All right, and I guess the last thing I have to report from Lac-Courte pertaining to this Health and Human Services is that Lac-Courte is designing their own tourist rooming house ordinance. And that should be completed. They've been kind of going off what the county's got putting together. they might be a little more restrictive as far as occupancy. But as soon as we get that drafted and approved, we can share it with the county. And hopefully we can coordinate and work together. They plan to enforce their ordinance within the reservation boundaries, probably be complete about the summer of 25. So that's all I have for LCO.
Any questions? All right, Senior Resource Center. Do we have a report?
I don't have the agenda in front of me, so I don't know what to report on, I guess. If I don't have any notes, I just checked my book bag. I don't have anything. Do you have anything, I guess? Besides what we discussed about our roof or whatever, I don't know what we agreed upon or what they want to pay, but Lynn, do you want to mention?
No, I was attending virtually on that one. I do know that they've now started assigning some committees, so I know the finance committee meets next week. I don't know about the other committees at this point in time, but I think the roof will be discussed at that meeting.
Oh, okay, thank you. Administration. Services list.
That's just our standard list that's in there. I know Andy's gonna do a little report out on, I don't have a whole lot. I've been on vacation for 2 weeks, so I'm just getting caught back up again, getting back into the office, but Andy, I'll turn it over to you.
Yeah, just wanted to touch on the tourist rooming house ordinance. So it did go to the county board at the September meeting for a presentation for information purposes. It's going to be back on the agenda this month for the board to take any action on it that they want. Since the board meeting, I haven't had any questions, comments otherwise from board members, but if you did have any, please forward them so we could try to get those answered before the meeting. And I'll just add too, that the only thing we're have to figure out between now and the board meeting is because the ordinance came out of this committee, it was sent to the board without a recommendation for approval or with no recommendation. Trying to address how that should be introduced at the board meeting. Usually we have a resolution that would go with it for either approval or adoption. Because it came out of here without any recommendation, we don't have a resolution sponsored by the committee, so. Right.
Have there been any amendments to it after it left this committee headed to the full board?
No.
How did the full board receive it? I mean, I was there, but it was just some simple discussion.
Yeah, I mean, I haven't heard any positives or, I mean, any, what you heard at the meeting is what I've heard. Let's put it that way.
And we haven't heard anything else either coming in our
And yeah,
direction.
no changes, as you saw at the board meeting, is the way it came out of this committee is how you saw it at the board meeting, and it's still the form it's in.
Are we still good, this board sending it to the full board without a recommendation?
That is up to you, but it's not on this agenda for any action.
So just to kind of clarify, so if we don't figure out how that goes directly to the board without the resolution, then we may bring it back here next meeting for just for the resolution to push it
That-
forward.
That would be the last resort.
Okay,
There's still ways, I mean, it's already been forwarded to go to the board. It's just that it won't have a resolution, the recommendation on it at this point.
So Julia, do you plan on doing a little presentation?
again, no, there
Again?
was a full presentation at the board, plenty of chances for questions. I think, I mean, I'm looking at other board members. Do you think that we need to go through all the hoops and whistles again with that?
Didn't Matt make a presentation last time, give an
Yeah.
overview to the full
A
board?
big, yeah, we had everybody talking. And I know you weren't there, Lynn, for that, but you might want to just go back and
I
watch.
did.
Oh,
I
did you? Yeah. So I didn't, based on the questions, I didn't, or lack thereof of questions or comments, I don't feel like we need to go back and And re-give anything else besides a resolution?
No,
And a
we're not
discussion?
planning on that.
Okay.
Okay, moving ahead to adult long-term care.
Okay, so Carol and I have been kind of hit and miss on getting our full update, but I do have a couple things to bring forward for adult long-term care. Open enrollment will be beginning, so that'll be a busy time in this fall for people calling in for questions and moving forward with plans. The other thing that we have begun talking about and knowing that there's issues with is the difference between if somebody has mental health needs or which is a Chapter 51, or they're in dementia and needing more of a guardianship or a Chapter 55. And what does that look like and how do we kind of mesh that through who is sponsoring that and how do we get that through the system? So that is one of the big things that we're going to be working on. So that it's usually law enforcement or the hospital where, which way does that case fall? So that we're looking through and also relooking at our guardianship policy, making sure that our fees match with where we should be and that's really clear for people to be able to follow in understanding, does the county sponsor the guardianship or is it a private guardianship that needs to be followed through on? So just some gray areas there that we want to be able to clean up so it's a little bit more black and white for people. So those are things we're working on in that area. Any questions? Otherwise, all the normal work continues with dementia care and everything else.
You'd like to move on to behavioral health?
Okay, behavioral health has a few reports in it. Anything, Alicia, that you wanted to talk about? Otherwise, I'll just kind of highlight. One of the big things is CLTS program is growing quite a bit. We are seeing that in a number of counties where that program is growing. So we have a position open for a service coordinator to help pick up some of that. One of the things that we know that we can't do is get a waiting list onto that program. There are a few counties that do have waiting lists. The state has clearly said that we need to make sure that we don't have a waiting list and we need to hire and make sure we have staffing so that people don't have to be put on a waiting list. It is one of those programs that's fully funded. We talked about an awful lot last time, but that is one of those positions. So that is moving forward and hopefully that will help get our children into the program sooner and more smoothly. We've got a few other things that we're kind of working through with behavioral health that hopefully will come to fruition in the near future, and we'll talk a little bit more about that. The other, so that is that just on the written report. We would like to move to the nothing really outstanding on the mental health costs by client report. It's just your normal report that you've been seeing every month. And this report is a new report though, so I'll talk through that. And then Joe is here and he can talk about his crisis report. So one of the things Andy and I discussed was trying to pull together a report that kind of establishes who we have in long-term mental health care that we are responsible for. And just to kind of give you that outline where we know these people most likely are not going to be coming off. So right now, we tried to keep this as vague as we could and kind of be able to give you the costs and what's being allocated. The 3 clients for sure will most likely continue to be costs that will be the county will incur, and you can see the ages. And then when clients get a little bit older, sometimes they can be more eligible for some long-term care. And so we'll be kind of always watching those clients along the way to see if we can convert them to another funding source. So just to give you kind of that long-term outline, when we're doing our budgeting, these are things that we're looking at. Joe, do you want to come on up? Because you've got your report in here. And then if anybody else has any questions.
I attached the last quarter, third quarter data there for crisis contacts. And, when you look at that, it looks like a bunch of numbers, doesn't it? But it really represents a lot of people. Every one of these contacts is representative of an individual. There's generally most of them have law enforcement involvement, sheriff's department dispatch involvement. They have, when they go on holds, they have the corp counsel involvement, the public defender involvement, hospital involvement, transportation involvement. So it's not just a bunch of numbers, it's really a lot of time and a lot of people and a lot of resources and costs. Our goal is to try to divert placements and contain costs. As you can see from that report that Julia had earlier, we have some high cost long-term placements. We can also have some high cost short-term placements. We like to stay away from Winnebago because it's our most costly. But the reality is, if anybody becomes somewhat combative, they're not going to take them in these other hospitals, They're not going to take them. We had one the other night ready to take up to Ashland, but then there was an incident. The individual became combative. Ashland says no, So you're going to the state hospital. Unfortunately, that costs us quite a bit of money with the transports. I would I take this time to thank the Hayward Police Department for really pitching in with these transports. And I would encourage you to look at developing a system where you might be able to provide those for some of the county cases at a reasonable fee rather than continuing to use an outside provider out of the county. So when I look at these numbers, you can see that, they change, but typically, we're looking at about 30 plus contacts a month. And there's a equal representation of adults and minors. Sometimes there's more male and female. The CD represents the children that were diverted from hospital placement as opposed to the actual CH to hospital placements. The adult diversions, again, adults that are not placed in the hospital. The adult hospitalizations, that's 50%. It looks like we're running, so that's pretty good. We'd like to get it down less than that. But unfortunately, sometimes there's a standard you have to maintain for care, and it results in the hospitalization. 72-hour holds, we had 7 in the first quarter, 9 in the second quarter, and 9 in the third quarter. Once that hold is filed, it goes to the court, and it sets that whole system in place. Have the public defender involved and corp counsel's time and blah, keeps going on. Most of the holds are mental health holds. However, they do have an AODA component, and that's kind of so oftentimes the reason for the mental health behaviors, especially with the young kids, when they're intoxicated or they're on some type of substance, they make threats more than you would think about ending their lives. Unfortunately, that's something that continues to go on. We try to safety plan people. That's what the SP is. CSP, that's our chronic mental health population. And you can see the numbers there are low. Last quarter here, 1 person. Second quarter, 0 persons. The first quarter, 2 persons. So the Northland Counseling maintains that intensive CSP program and client contact in order to avert those high cost placements. So to me, that shows it's successful when the numbers are so low. And some that we can come up with, no services necessary. Those are the ones I kind of dispose of and say, well, are they suitable for jail sometimes? If somebody is, arrested and they're stable and they're going to be charged, if they can go to jail, then they go to jail, and then deal with the mental health stuff afterwards. So I had one call not too long ago where they called me up and they said there was I got woke up at 2:30 in the morning it was a young girl that came home late and the family's arguing and it was like, she just wanted to take a shower and go to bed. And, they said, well, called an officer because mom says you can't take a shower, just go to bed. Well, if I can't take a shower, I'm gonna kill myself. When they call me up on those calls, sometimes I say, why don't you let her take a shower and go to bed? Just try to divert some logical things and, have logical things as opposed to calling somebody out. So thank you. Any questions on these numbers at all? Or any of the programs involved in this? I see the law enforcement officers know what this is like. They've seen these holds before.
Thank you for being there.
Well, thank you. Thank you for the support. Appreciate it very much so. Have a good night.
Andy, we talked about that before, don't we, about the different law enforcement agencies doing transports or having some agreement. I know we transported somebody last night. I think county also paid for Callan for somebody else last night too. So I know it's quite the burden on the county or whatever, but it would be cheaper, I guess, if, tribal PD or town of Hayward PD or city of Hayward or county, if someone's not available there, if there was another agency that could transport, it's a heck of a lot cheaper than hiring these secure transports, I guess. I don't know if we talked about that at CJCC or public safety, or was it here? I don't know whatever happened with it, I guess. Anyone know?
Yeah, I don't remember where we talked about it, but we did talk about alternatives of even if those agencies wouldn't do it, even if the county would pay them or, having, Hayward PD or, town of Hayward PD be, made employees of the county just to do transports, making those deputies able to do, when they're not working for those agencies, do transports for the county. I kind of left that with the sheriff to follow up on that. Part of what you heard too is with creating that additional position in the sheriff's department for court security is that the plan is in the sheriff's office to make the court security available to do transports when they're not doing court security. Yeah, it's been an ongoing discussion with Joe has let us
Yeah.
know about the cost of having talent come in is considerable. It'd be much better if we could work out a solution with our existing agencies.
Mhm.
Well, in most instances, I will say this, that if you have the opportunity, let's say you had some officers that would be willing to do transports. If you did the transport and billed us timely wage, even at overtime, if you guys wanted to make a little overtime, we would call them, put that in the loop, have a system in place, call them in charge of, after hours, just say, if you had an officer that wanted to work for some overtime, we paid that overtime cost and mileage, it would still be cheaper for certain than portal to portal from across all the way here at a loaded rate,
Yeah.
Sometimes we'd like to do that.
I think that's part where you're working with other agencies would be potential. Now, I don't make the calls. When Joe needs a transport, he calls the sheriff's department and they're responsible to do that. But I've been told that anybody, in our department that wants to take them as first crack at them, including on overtime. And when we call in talent, it's because nobody within the department was willing to take the transport. But if we had access to officers at other agencies, that would open up the pool, then we're people that would be available to do that.
What do we need to do then? Get an MOU with other agencies?
Yes, and I will take it up with the sheriff again. I believe by statute, it's up to at least in our program, it's the sheriff's department that has the discretion on how the transports are accomplished. So we need to get them on board to work with Hayward PD and the other agencies. I don't know how often, honestly, town of Hayward or LCO police have been involved in the past. I know historically we've worked with the Hayward Police Department, even, covering Hayward while Hayward might take a transport for us.
Yeah, and I know, from you, we just had this discussion today on youth, and I know that LCO has been really good on transporting youth that are in that area, picked up in that area and transported. So just from, obviously not on the mental health side of things, but on the legal side of things.
It's an ongoing discussion, yes.
We can add it to our agenda to bring it back. I think that might be a good agenda item to see where we're at.
At the last meeting with the hospital just last week, the hospital came for
Hey.
secure transports too.
Can you talk in the mic?
And they're utilizing, they're saying that the cost that they're getting billed $2,500 plus to have, right? Marshall was there to go to Winnebago and back from Talon. They're at a higher rate than us, it sounded like. And they would be more than willing to contract out with somebody else. So, might be.
We'll add this on transport.
Okay, let's
You
move
can bring
on
it up
to
tomorrow.
Child Protective Services and Youth Justice, please.
Okay, Sarah is here. And your reports are attached, but I think you probably have some key things you wanted to talk about.
So reports are attached and I was going to touch base on a few new exciting things. I know in the past meetings, we've been talking about some of the grants we've been approved for to start working in youth justice. One is the Youth Innovation Grant that is for $100,000. We were also approved a federal grant that was $87,500. We are also working on a second federal grant where we could be awarded $100,000 to $300,000. So we are looking at, again, starting the diversion program, which I think I touched on last month. With the federal grants, we're looking at contracting with a program called Sorona, and that will it'll look kind of like an extension of the youth justice program, but really focused on diversion and trying to prevent youth from entering the formal youth justice system. And what that will look like is we will have workers going into the homes more often, working with families on communication, implementing consequences, implementing rewards, maintaining consistency and stability for kids. So yeah, that's kind of what we're looking at. If we get the second federal grant, we are going to be talking about implementing a therapist to work more in the homes with families. Our goal would be that CPS wise, this starts to lower our numbers over there. It would start to lower out of home costs for both CPS and youth justice. We are going to be starting to implement this January 2025. And we will first kind of hone in on truancy and working with schools and law enforcement, especially the school resource officers, and being able to send referrals our way. And then the second piece of news I have is more on the CPS side of things. Some of you may or may not know that the CAC that we had locally here in Hayward, so it's the Child Advocacy Center. So Jane Flagstad used to be the person who was specially trained to do those interviews. However, funding was cut and her area here in Hayward was one of the first ones to be cut due to that. So we are and have been thinking about how we can sustain this program. And we're going to be able to offer our space kind of on the HHS side of things in our conference room and family room to do these interviews. And our plan is to have myself, Tysa Marlowe, and Julie Loader from LCO all certified to do this special interviewing with children who have been abused, to keep that going. Any questions?
It's one more thing. to add on that. If the one thing, I think Eau Claire is the next closest, or Duluth, if we were gonna need to do interviews. So it's a long ways to be able to send kids for something that's very traumatic in the first place. And then the other thing is we've been talking with Washburn. They do have some people who are certified in the interviewing. They don't want to do it long-term, but are willing to help support us in the short run. So we're trying to make sure that we don't have to send children long place away to have these interviews done.
Congratulations on those grants. That's really good news.
Mhm. Anything else that you have questions on for CPS or Youth Justice? Okay, economic support. I believe Shauna is on, and her standard report is in the packet.
It won't change. Frozen.
Oh, the report won't change? Well, I wonder if Shauna can even talk. Oh,
I'm here, Julia.
okay. Do you have any updates? I know last time you talked about MAP and how that was going.
I'd like to say that it's getting better. I don't know if it is, but I know that they are, we have work groups meeting weekly to try to get it resolved. So, it's definitely being worked on. I know that they have made a few advancements. One of them is the payments made by the Access app. They were having trouble with that, and those have been resolved, with the exception of, if a member has a pop-up blocker, say on their phone or something like that, that kind of prevents them through going through the process. But workers are aware and are able to help members if they reach out with those struggles. So we're still just working through the MAP process. And then the other thing, kind of what was brought up with long-term care, and we have the marketplace application starting. So that will make it busier for this department through the end of the year. There has been overtime offered up to 50 hours per week that's covered by consortium dollars. So that's about all I have, unless there are questions on the report. Okay, thank you.
Shaking heads. I don't see any questions. Okay, we have a public health update.
I did include a recap of our recent events in my written report, including a recap of the full-scale sheltering exercise, the Walk for Tomorrow events, and the Clean Sweep event. I did want to highlight a couple ongoing outreaches that we're doing right now. We are doing the flu clinics at both Hayward and Winter schools, so those have begun. And we also are doing a Word to the Wise initiative, which is senior citizen emergency preparedness, and we're reaching out to the senior centers for those. And the only other item that's not in my written report that I do want to highlight is our Community Health Assessment Stakeholder Meeting, which will be held October 29th from 1 to 3 at the Hotel Fall Creek. Is it Fall Creek? Flat Creek, sorry. I knew it
Sorry.
started with an F. Flat Creek, and that is a stakeholder meeting to discuss preliminary results from the initial public survey, and also to get input and insights from businesses, community leaders, clinics, other agencies with a vested interest in the community's health. Any questions? Thank you.
Okay, I think we're just kind of a broken record on where we know our expenses are outside, and that is on our out-of-home care costs. So that is not changed. Did you put your report up, Carrie? Or did you sign in?
I am signed in.
Okay. Can you make her a host? Or whatever, she can share screen. Thank you. Not a host.
Well, hello to those that I didn't meet last month. My name is Carrie. I'm the new deputy director. And I am focusing a lot in the fiscal area. So
Oh, you gotta
can you hear me?
mic up just.
Can you hear me? Yes. Can you hear me?
Talk
Okay.
louder. There you go.
Okay, sorry. All right, so I just wanted to share some exciting things, at least some exciting things to me, as far as streamlining some of our billing processes. Can you still hear me? Okay. So I know we've talked in the past in regards to that we have a couple different billing systems that we use. So I have been able to streamline a lot of the processes and really leverage some of the capabilities that our systems already have in place to really not only streamline electronically sending out our claims, but also receiving them electronically. So we are, receiving those payments quicker and really just streamlining the process altogether. We are really doing a lot of manual entries that were really taking up significant staff time. So I've really been phasing in on how we're doing this with an approach. So I kind of broke it down so you can see and the green and orange dots are the different areas that we currently do billing for. So we have our birth to 3 therapies. So that's like your PT or OT or ST for therapies. We have crisis, the reproductive health. We also do case management for birth to 3, and then our CLTS billing. So all the first 3 items in green are ones that we've already implemented as far as start to finish. So everything electronic. So all the claims are going electronically, receiving electronic payments. We're also able to post them electronically. So the staff doesn't have to go through line item manually and entering everything. So that's been really great as well. So, all that to say, our estimations are approximately about 37 to 40 hours saved a month of staff time once all this is fully implemented. So we're about 70% there. So looking at coming to a close and finishing this hopefully at the end of this quarter. So that's really in a nutshell. So I wanted to share that exciting news. So any questions?
So has it shortened the time frame from claim to payment
That's right.
by approximately how much?
I mean, I couldn't say for sure in terms of a study, but as far as staff time, we've looked at overall staff time, but I would say, a couple of things, right? So there's a few components. So we were receiving mostly paper checks. So now we're receiving EFTs, right? So, that could be anywhere from, a week's time to, 3 weeks time, I would say. Sometimes checks take a lot longer to come through the mail. So does that answer some of what you're looking for? Okay. All right. Thank you.
So along with kind of doing all of those projects, Carrie is really taking the lead on the grant writing and pulling us all together and getting pieces together there. We've got one which we're going to pump out by Friday. Hopefully, we'll be devoting some time. I think I put a little kink in that because I took vacation probably when we needed to get some stuff done, but we'll get that out. And then I know there's a couple other grant potentials that we're looking at too to help supplement going into 2025. So we'll keep looking at that and braiding and blending our dollars as best as we can. And we need this, we really need some of these services. So we want to be able to keep giving that to the community. So we'll do what we can to help support that.
Guess I got a
Any
question for you.
questions?
Yeah, Julia.
Yes.
Are we tracking with our budget as far as these out of county placements then, or is
No,
this?
we're way over.
Way
On-
over?
On the youth justice side. We are under though on our CPS placements. and tracking pretty good. I don't even want to say that on our mental health side of things. I don't want to jinx us towards the
Right.
end of the year here. So we're kind of watching that real closely. But we did, going into the budget year next year, have put, manage that better into the budget, knowing what we've been averaging. We can kind of see it over time now, what we've been averaging per month. So hopefully with these programs though, I mean, we're not going to see a change, as soon as we start diversion programs and things like that. But ultimately, we would hope that we're able to keep kids in their homes more, allowed to give them a little bit more support to the family, see less out-of-home placements and less kids into youth justice. So it'll be just like how we worked with Justice Point, and it took a little bit of time to see those changes. But now we're seeing some real positive outcomes with that programming, and it's time to do that with the youth. Go ahead.
Yeah, and I'll just add on to that, if you want to look on page 38 or 39, probably, I don't know, 3/4 of the way down, halfway down the page, under juvenile justice, you can see what was budgeted and where we're at. So we're 2,424% of the budget. It's not good, but I can't give you any explanation to say this was being ignored before. What was supposed to be being done was not being done. And so I think when our CPS unit reorganized a year ago and we were put some work in the juvenile justice area, we started taking on or addressing some of these cases that were not being done. So we do have 4 individuals right now at Mendota or Lincoln Hills. Is that what I read? Roughly.
3 now. Well, it changes. Yeah, the
It
report's
changes.
old.
I mean, a year ago or 2 years ago, we had none.
Yeah, we hadn't had any for.
So like Julia said, we've met or probably put a more realistic budget number into next year's budget, which is one of the reasons you saw an increase in the HHS budget. But I think, again, now we're looking at long-term investments in the diversion program and trying to address these issues so we don't have to have people in long-term placements or out-of-county placements.
That be the item under secure detention?
That is correct.
Mhm.
And as a positive plug, I would just say on the other side, I look at CPS as 2 sides of the house,
Mhm.
Child Protective Services, Juvenile Justice. On the CPS side, with the changes that were made there and the staff we have, there's been a lot of emphasis of getting those kids in less restrictive or back into homes. So you've seen that, to me, that ledger, so to speak, has cleaned up a lot. You've seen some kids that were in long-term situations being, either put in a home or back in their home. And you see the fair managing of the cost there on that side.
I think we're down to board appointed committee updates, if we have any reports from anyone. Future agenda items.
We said that Sorry, I think we said we'd just put transport back on there. I can just put it under the mental health section.
So Andy, you mentioned about the resolution. Do you think that it's going to
Oh.
come back to us next month for a new resolution?
I don't see that because it's going to be on the board agenda. So I think the board can take action without a resolution if it wants to. It just would make it cleaner if we had a resolution for the board to act on to either approve, to either adopt or not adopt the ordinance. So I have to do a little more digging on that and talk to council one more time to see if there's a way to do that. It's not going to come out of this committee, but potentially if there are board members who would want to sponsor the resolution, that might be one option to put it in front of the board a little cleaner, or we just go into the meeting without a resolution and the board makes a yay or nay vote to approve the ordinance.
Can you give us direction on how to do that as a board member?
Sure. If you're interested in doing that, let me know.
The two.
It's two at a minimum.
Okay, so we'll follow. The other addition that we'll have on the agenda is actually related to Joe when he was talking about how far we have to send people for crisis beds. We do have a resolution that we'll be bringing forward next month.
We saw a draft of it from Polk County a couple months ago. We just didn't have the draft ready to go on the agenda for tonight, but it's just a number of counties are passing it, asking for a secure facility to be established in
Crisis
northern
center.
Wisconsin, a crisis center, right?
More local to us, like more in the northern region. So it'd be nice.
Okay. Carol, may I add, Andy, where is that at? Is that in the infancy stage or,
It's in the advocacy stage, infancy, yes.
okay? And I also, did you say you're gonna bring the transportation to Samantha?
We'll see if we get any progress or where we're at so that you know what our plan is moving forward. Mhm.
Is there any correspondence or reports from conferences and meetings that anyone would like to share?
Well, Andy, I was just gonna ask you, at Wisconsin County's last meeting, were there any resolutions passed or that would pertain to us or to?
Honestly, didn't go through the business meeting afterwards to see which ones passed, but the big one that we advocated for and I know went through was for fully funding the non-federal share of crisis and
Oh, the
mental health
crisis and the CSP
CSP
program.
program. Right now, the county has to fund the non-federal share, or I guess the state and the county, but the state usually doesn't have enough money budgeted. So the county picks up the non-federal share of those costs. And so those, and I guess that's something I'm probably gonna ask from HHS, like to maybe give us a calculation. The breakdown you had of those, like those high cost placements we have right now,
Mhm.
how much of that is being funded by the federals or state allocation and how much is the county picking up?
Okay.
So you can get a visual of how much this CSP program costs the county that's not funded by federal or state dollars. But that's where the counties are asking the state to pick up that cost. It's a huge number overall, which means the county share is significantly large, yes.
And isn't that a mandated service we have to provide?
Yes.
Then we should be funded for it.
Yes. Theoretically, everything that's mandated,
There's a
yes.
list of those, but yes, you're right. It's like the court system is a state court system, but
Some of the
counties pay for that.
programs that the funding hasn't changed in 15
No,
years.
yeah, they don't go up.
And doesn't the state own that facility?
On both Mendota and Winnebago.
And that, I think, had a 10% increase, didn't it? This year?
Rates just went up, yeah.
Yep. Yeah, yeah.
And then we have no choice not to pay them because it comes right out of our funding, right?
Yeah, it comes off the back, yeah.
I have a quick question. Are all the opioid reimbursements, are they all done now? Are there still more?
There's still more. I mean, we'll be getting opioid settlement dollars for the next 16 years.
Well, what I'm hearing from news reports and whatnot, there's other states, there's other places that are all part of that opioid thing. And what they're doing is they're able to divert money from that and put it towards like grandparents taking care of kids. And that it's getting approved, and there's a couple places in Wisconsin that are doing it also. So I don't know if this would help, because then we could offset money that's going into these other things into something like that from the opioid, which is affecting all these families.
Yeah, I'm not familiar with exactly what you're talking about. I mean, we've really adhered to Schedule E. of the
Exhibit
opioid-
E, yes.
Exhibit E of the opioid settlement as to how the funds can be used. Now, there might be places getting more creative in interpreting that, and maybe that's something we
Well,
can look into.
Yeah, and actually, we can add that to the agenda for next time and something that I've planned on spending some time on anyways right now, so we can get it on the agenda. And I can bring the exhibit.
Else?